Welcome viewer. Today I want to discuss about immunohistochemistry in brief. Assalamu alaikum wa rahmatullah. Immunohistochemistry is the most application of immunostaining. It involves the process of selectively identifying antigen in cell of tissue section by exploiting the principle of antibodies binding specifically to antigen in biological tissue. Immuno means antibody, histo means tissue or cell. Chemistry means chemical reaction with antigen and antibody. Specific antigen detection by sample preparation, direct visualization by electron microscope, analysis by computer vision or data analysis by specific protein examination, immunopathological evaluation. Electron microscope is the principal part of immunohistochemistry. Immunohistochemistry now essential for research in the lab or evidence with surgical pathological information. Immunohistochemistry of ovarian tissue. This is the tissue how taken from a surgical part with pathology and immunohistochemistry. Immunohistochemistry is some procedure after to fix the cell tissue protein. Here primary antibody, indirect immunochemistry and immunofluorescence, the primary antibody, indirect immunochemistry, the extra secondary antibody use. So indirect immunofluorescence with secondary antibody conjugate to a fluorophore. This is fluorescent technique, chromogenic. Immunohistochemistry, the principle, some procedure, dewaxing, hydration, closed endogenous peroxidase, antigen retrieval, primary antibody, secondary antibody, and color development, and finally visualization under microscope. Immunostaining technique. Immunohistochemistry, the histogenesis, differential diagnosis, reactive neoplastic state, etiology diagnosis of infectious disease, and determination of prognostic factor, determination of direct therapy, location of primary tumor in malignant disease, determination of specificity. Immunohistochemistry is used for research for cell or tissue antigen that range amino acid and protein to specify infection. This review covers immunohistochemistry technique, its history, application, importance, limitation, difficult problem, some aspect related to result interpretation, quantification, and method used to benefit of the patient in order to achieve the goal, collaboration, and pulling knowledge from both of these valuable medical areas. Presence or absence of particular molecule is the diagnostic clue. Immunohistochemistry important application monoclonal as well as polyclonal antibody to determine the tissue distribution of antigen interest in health and disease. Diagnosis of cancer cell. Specific tumor antigen are expressed to de novo upregulated certain cancer and deals with the various application, immunohistochemistry, diagnosis of the disease, and research purpose. Immunohistochemistry diagnosis of the cancer specific tumor antigen presenting in especially oncologic pathology, neuropathology, hematopathology, and autopsy pathology. Basic histologic examination of the tissue useful for necessary in component immunohistochemistry. Analysis of the tumor method significant improvement over the conventional prognostic consideration. The tumor marker, the physician immunohistochemistry to diagnose the cancer, benign or malignant, determine the stage of cancer, grade of tumor, identify the cell type, origin of metastasis to find a site of primary tumor. And some fluids, sputum, material obtained from fine needle aspiration, cytology, detection of pneumocystitis from the sputum, immunocompromised patients who need rapid and precise confirmation of infection in order to begin immediate and appropriate therapy. In genetics, function of the specific gene product, fundamental biological process, development and apoptosis. P53 homologue of the pro-apoptotic pathway of P53 was identified. In neurodegenerative disease, specific vulnerable population of the nerve cell, subclassification, neurodegenerative disease, development of consensus criteria of the disease. In brain tumor, immunohistochemistry staining of beta amyloid precursor protein has been validated. Method of detect axonal injury within a little 2 to 3 hours of head injury. Immunohistochemistry detection axonal injury can be useful establishing timing of traumatic insult medico-legal case. In the muscle disease, identified muscular dystrophies, such abnormality protein located in the sarcolemma, extracellular matrix cytosol site with muscle fiber, skeletal muscle biopsy, differentiating the vascular dystrophy, non-dystrophic disorder. Immunohistochemistry can assist specific diagnosis of the dystrophies for which the specific protein abnormality. In research purpose, the beta amyloid, alpha synuclein, ubiquin, Huntington, polyglutamine, other has become routine tool for sensitive detection, quantification of abnormal protein by immunohistochemistry. In coronary atherosclerosis, also immunohistochemistry has detection, some decision. Histocytic nature of the cell. The prostate-specific acid phosphatase, prostate-specific antigen CD68 positive demonstration by immunohistochemistry. Whole fluorescence in whole slide staining. In invasive breast cancer, also detection by immunohistochemistry. Selective estrogen receptor modulator inhibitor growth progression, pre-malignant lesion. Development of quantification method for detection. Thank you very much for listening, watching. Please subscribe, share, and well-being of mankind will update. Thank you very much. Assalamu alaikum wa rahmatullahi.